Good afternoon, good afternoon, everybody. I'm Dr. Gurvinder Saini, one of the alumnus from Vaishampayan Memorial Government Medical College. It is an honor to be talking to you today. My topic for today is artificial intelligence in healthcare. What is the current scenario and what are we expecting for it to help us within future? I would start with these two news items from the US. The first one was a common newspaper which was published in January this year, and it was saying that AI could pass US MLE. And then just a month later, American Medical Association also published an article saying that ChatGPT could pass MLE, and what does it mean for medical education in the future? Few months later, there was another article in Australia in one of the publications which is targeted at Australian doctors, which was saying that they asked artificial intelligence program to sit fellowship exam like ChatGPT only, and they were surprised that it could pass the exam with the score of 60%. Here, I would like you to take a bit of a step back and think about it as to what do you feel about it? Does it make you concerned? Does it make you alarmed? Are you feeling excited about all of this, what's happening? Just to test it myself, what I did, I posted the same quest to Chat GPT. Maybe I was cheating as to about my topic, and I asked Chat GPT as to how can artificial intelligence help healthcare in future, and it came with pretty much everything that I had thought of. So it is something which is smart for sure. Coming back to the topic or agenda for today is to talk about what are the types of artificial intelligence, what is the brief background, how are they helping us in the current situation, what could be the future applications, and some cautions and controversies, because nothing comes with pretty much everything in its favor. There are always shades of gray that we need to be careful about, and we would have small conclusion as to whether it is something that's doable, workable, or it's something that's going to be a dirt start to begin with. What is artificial intelligence? So it's simulation of human-like intelligence in machines that are programmed to human cognitive function. So cognition is the main keyword, that they can see what's happening around them, feel what's happening around them, interpret what's happening around them, and then hold that memory, hold that input or intelligence in their mind and use it for future applications. So I wonder whether it should be called artificial intelligence or it's actually intelligence. And there are certain people who would call it augmented intelligence. And I would also think that maybe non-human intelligence is another term that can be used for it. It's a broad field and there are quite a few overlaps. But to put everything in context, artificial intelligence contains the subset of machine learning, which is about having machines to crunch on data sets to derive patterns and then have predictive insights and help us with making future decisions as to whether that should be workable or not. So machine learning is when we try to teach a machine how to interpret data. A subset of machine learning is deep learning, which is based on neural networks, and neural networks are those that mimic the function of human brain, and they can use their own internal mechanisms to find associations and come up with conclusions and answers. I would explain that in on the next few screens. So the basic difference between machine learning and deep learning is about the data being structured or unstructured. So on the screen, on the left-hand side, we have got a small brief summary that for a meeting, there were 100 people before lunch, and out of those, 55 were females, and after lunch, there were 16 attendants and 40 were males. So this is unstructured data. It needs a bit of insight as to what are we talking about to understand it. On the right-hand side, the data that is given in tabular form is structured data. Computers know and learn how to use it. Pretty much the computers that we use these days, like the ones which you and I have. However, it takes a bit of different approach to make computer understand the data on the left-hand side, which is unstructured data. That's what is natural language processing models about. This is similar thing on the scale of a medical image. there's these are two slides of melanoma. On the left hand side, the slide is just showing the histology. On the right hand side, it is labeled. So the labeling is the one which is helping us interpret as to what we would be expecting the machine to look at and come up with the conclusion. These are the differences between machine learning and deep learning. Machine learning relies upon structured data. Deep learning can work with unstructured data as well. So this is the way the things work at neural network level. If you were to talk about what neural networks are, this is the first on the left hand side. This is the input layer. Whatever it's getting, it's feeding to the further layers, and then ultimately you have an output layer which tells you whether this image that you are showing on screen is a dog or a cat. We didn't tell it why this dog is dog or why this cat is cat. We just told this is a dog, this is a cat. We trained the model on hundreds and thousands of images, telling them this is dog, this is cat, and the machine has to find out that association. This is deep learning. We do not tell them why a dog is a dog or why a cat is a cat. That was a simplified version. In actual scenario, you would have multiple hidden layers which would be working through the whole process and then coming up with the conclusion. This is exactly the way we learn things. This is what the neural networks are about. Now, coming back to artificial intelligence, what I would broadly categorize them as would be that there are those which are highly dependent on the computational power of computers, and the second ones would be which are more like having a bit of tinge of cognitive function to them as well. This, mind you, is a very arbitrary classification because there is nothing which is relying only upon computational powers or only about cognitive functions. They all go hand in hand. But this is just to sort of have some bit of discrimination or distinction to decide and to talk about those things. Now, when we talk about computational powers, you and I can imagine that machines can work 24/7 without getting fatigued, and they would be still as fresh in the evening as they would be in the morning. So they can be used for data mining, they can be used for pattern recognition, and also for workflow management. We'll see examples of all of these, and these are being currently used as such for these applications in medical practices and other fields as well. When we talk about data mining, it depends on a capability of those machines to understand natural language, which is unstructured and not having any tabular format to it. That's why ChatGPT-4 is called a large language model, because it can talk to you in a conversational manner rather than you trying to talk to it in a computer language. What they can do, they can interpret large amount of data, they can analyze it, they can interpret it, but be mindful that do not understand it. They would not know what is the implication of being a diabetic or being a person with Alzheimer's. They would know this is diabetes, this is Alzheimer, but they wouldn't know what the implications. This is good in a way. And they can find associations that may not be obvious to human observers because we can only focus on so many things at a time. What are the implications? We can parse through vast amount of data, which pretty much all the medical schools and medical colleges all around the world are generating, and then find those associations that might have been missed by you and me because we are not that good at processing large amount of data. Most of us, not all of us, most of us. It can also help us understand epidemiology. If you were to keep on only logging causes of deaths for people in a particular community, you can find trends in that, and you can compare that across different population subsets and see what's causing where is it happening, and that can also help us understand the prevalence and the incidence of disease in a particular society. And also it can find obscure associations which might have been missed, that would help us come to the proper diagnosis and be careful as to what are we talking about. Pattern recognition. So again, coming to this particular thing, medicine relies very heavily on pattern recognition. So you would have come up with those triads for things. Those triads are nothing but patterns. If somebody has had fever with chills and rigors happening every second or third day, you call it malaria. Somebody has been born with down slanting eyes, they have got simian crease, and they are drooling from the mouth. They have but mongoloid faces, you call that Down syndrome. So those are pattern recognitions, and pretty much most of medicine is about pattern recognition. And it has been shown that humans may be inferior to machines in terms of pattern recognition. So not only you can help with disease identification, because the machine can look at much bigger picture than what normal human can. They have got really particularly important application in managing intensive care units. So there have been studies which have shown that if you were to program machines to check on patients who are likely to develop sepsis, you can get idea about somebody who's going to develop sepsis about 6 hours in advance from machine learning programs than what humans would pick. The machines can look at it that way in a better manner because they can integrate all the different channels of data, which could be heart rate, saturation, respiratory rate, depth of breathing, level of consciousness. All those things can be integrated together, and rather than following only one of them, machine can integrate all of that and then come with an output. Imagine treating somebody before they even develop warm shock for sepsis, then somebody who is in warm shock or cold shock. The outcomes would be entirely different. So that could be the leveraging of technology that can happen if you were to implement it correctly. Also, the machines can help with pattern recognition and help us with drug discovery so that we can find biosimilar molecules and waste down and reduce the time from idea to concept to delivery of a medicine, because those things can be done more expertly, expedited quite quickly. Lastly, about those things in medicine that are just like clerical jobs, workflow management. That workflow management again can benefit immensely from use of machine learning programs. Like I was saying, the machines know the implication of things, but they do not understand. So they would know that diabetes is a priority, person with chest pain is a priority, and they can allocate slots for those people for appointments at a priority place rather than using it as only first come first served basis. It has been shown that allocation of operation suites, if you were to use artificial intelligence, it works out much better than if you were to be relying only upon humans to allocate those resources. There are studies from Massachusetts Institute of Technology which are focusing on this. I imagine that even ambulatory medicine appointments can benefit immensely from and make machine learning helping us with offering appointments rather than doing it only first come first served basis. And lastly, there would be a big amount of help coming from repetitive administration tasks like writing notes, categorizing, filing. So you can dictate a note, machine learning would process and interpret that into a tabular form and put it in where it should be. It would go to all the appropriate places in the patient's file, electronic health record, and then it would be easily cataloged and you can even retrieve it later on. So that would be done by machines rather than you and me. And that can save quite a few hours. They say 4 hours of clinical time can be saved per day if you were to integrate user machines properly in day-to-day health conditions. Now let's come to the other part of topic, which is about, say, cognitive-based applications, like we were discussing machine learning and deep learning. What machine learning is, like I was saying, it is about labeled data sets. So technically, it's using machines to analyze data so that you can have predictive outputs from them for the future, depending on what sort of data they have been used to train with. In this case, what you can do is you can actually change the biases and weights for the input layer so that you can fine tune the machine to come up with certain types of outputs, which would be more applicable and more, you can say, correct for that particular scenario. And after that, you would have a test run on it, and then you can deploy it. Applications could be that it may process large amount of data and work 24/7 and can compare data from even disparate time points, which means that you might even be able to look at patients' files from 5, 10 years ago and still get the data about their HbA1c levels or their kidney health and all that stuff. Deep learning, like I was telling you, is about unlabeled data. and it learns from its own feedback. There are forward propagation and backward propagation, and it self adjusts those weights and biases. You wouldn't be able to know why is it doing what it is doing. And the applications are about image recognition, self learning, and improving its own output, and adjusting to underlying factors such as unique situations about ethnicity, skin color, and all that stuff. Let's come to the applications that are there currently available. We're talking about some random examples, and I must say that these are the ones which have been actually tested and tried and are in current use. Atrial fibrillation, retinoscopy, skin cancer detection, use of artificial intelligence for diagnosing, reading mammograms, and also the use of smartwatches. Atrial fibrillation, like you're aware, is to begin with a paroxysmal condition, which means that it happens every now and then. And people might come with those symptoms to you, but they may not be having the findings at that point in time. So you might perform an ECG, which comes up as absolutely normal. So the burden of disease could be much higher than what you actually see in the clinical setting, because part of it may not be detected because of the time when you're seeing the patient. The way around that would be to do or monitor heart health out in community. And there has been development of applications or small devices that can be fitted into your pocket, that can be carried around, and you can use them at will. Alifcore Cardia is one such mobile ECG, which is an FDA approved device. You can use it as needed, and it can record a single channel ECG by just putting your fingers on those aluminum pads that you see on the screen. And you would get an ECG recording in PDF format on your phone, which you can even transmit to the healthcare provider. This is quite revolutionary because then you, with these particular sort of scenarios, you can record that particular cardiac activity at that point in time rather than waiting for you to go to a hospital and then getting it done. Similarly, retinoscopy, this article from March this year in Ophthalmology Science says that AI is more sensitive than retina specialists in picking up changes in retina due to diabetes. And not only diabetes, there are studies which show that it is helpful. The next, this particular type of approach relies upon convolutional neural networks primarily. There is this article coming from Mount Sinai Health Systems, and it is again from this year only. And it is quite surprising. I would spend a bit of time on this slide. What was done that they showed images of retina to the machine learning programs and told them about diagnosis of large subset of people and they just showed an image, told them what the diagnosis for that person are. That could have been, say, diabetes, hypertension, Alzheimer's, and whatnot. And then when they started showing the images of random people, like other patients to them, machine learning or the AI programs could not only tell them about presence or absence of diabetic retinopathy, but they could also find out or predict the gender of the person, the likely age, whether they smoked or not smoked, what could have been their systolic blood pressure or were they hypertensive, and if they were at risk of having major cardiovascular events. They could even predict development of Alzheimer's in them few years in advance, which was, say, picking up mild cognitive impairment. They also could correlate whether the person had lower normal HDL levels, which are supposed to be protective for heart disease, and they also could predict the cardiovascular disease and risks for stroke. It's quite eye opener, exactly because it's looking at retina. But what I'm trying to point to is that imagine somebody sitting in remote areas of anywhere in the world. Somebody just goes and takes a snapshot of the retina, and that data can be processed in a faraway place and come up with all those predictions, which could have taken you lots and lots of tests and lots of human effort. This is the beauty, and this is the future which we should be thinking of or trying to build upon. Like you guys must be aware, Australia is probably the skin cancer capital of the world, and that's why there has been a focus on melanoma and developing technologies that can help us pick up melanomas. Because clinicians, especially the primary care physicians, may not be that much conversant with diagnosis. And you cannot imagine everybody going to a specialist to have that diagnosis. In this year, there was this article published in Cancers, which was a meta-analysis of 40 papers that were published between 2018 and 2020, and they compared machine learning algorithms with optical coherence tomography or reflectance confocal microscopy to see whether they had similar sort of outcomes to dermatologists. Overall, the sensitivity was 83% and specificity was 85%, which is supposed to be at par with Pet's good dermatologists. It's not surpassing them, but it is not inferior to them either. The challenges could be the skin of color because most of the study data would have been based on Western population, and it needs to be indigenized to people who might not have that sort of fair skin. And that's why we need to be careful about training the data sets, training the program on data sets coming from people from different ethnicities. Now, this is again a study from this year only, coming from Stockholm, which was about reading of mammograms. So the study tried to compare the reading of mammograms between two sets of groups. One was two radiologists reading for one another, and there was the other one which was radiologist plus artificial intelligence. The second set of radiologist plus artificial intelligence could pick up 4% more breast cancers on mammograms than two radiologists reading the same set of data. The challenges are that you can definitely say that AI is better or it helps us improve the outcomes, but ultimately at the moment the responsibility is with the human. So you cannot say that I said it is cancer because machine said it is cancer, or I said it is not cancer because machine didn't agree with me. So that cannot be done. So that's the reason we need to be a bit careful. Coming to again something like which would be part of future is about those wearable devices that can track your health 24/7, and they can also generate large amount of data which would be helpful in looking after your health because that would be available 24/7. Smartwatches like Apple Watch are FDA class 2 approved device for arrhythmia detection, similar to but not equally good as Aleve Core Cardia. They can give you a bit of idea, but they are not as accurate as Aleve Core Cardia. They can help us with tracking sleep. They can also help us detect cardiac recovery rate, which is about how quickly after exercise the heart rate tends to come back to normal. This is a measure of cardiac fitness. Then they can also have algorithms that can help us predict what is the maximum cardiac, where is the maximum oxygen consumption by the body. Again, a marker for fitness. Not only that, they have got accelerometers and other sensors on board that can help us with fall detection, crash detection, and the machines can be, these wristwatches can be programmed to call next of kin or emergency contacts in case they detect something which is not going right. So not only they would be helpful, but they would be generating large amount of data which needs big operational efficiencies on part of computing devices to store them, interpret them, and then predict from them. I'm just gonna mention in passing about studies from MIT Baltimore, which is about non-wearables. They were a little concerned about wearing something on your body, which might itself be a bit of a burden. So they came up with other technologies. They were relying upon these ever prevalent wireless networks. They are in the waveform, and they are around you and me, and our body is interacting with them. They came up with computational models that could tell you if somebody is sitting in a room, standing in a room, walking in a room, tracking their movement, even without touching them or having any wearable on them. These things are again in infancy, but hopefully they might be the way to go because they can be just a device sitting on your wall and then monitoring you without even you having to do anything about it. You don't have to wear it, it's just working in the background. Now, coming to the future applications, drug discovery is one thing which I have already mentioned about, but again, you can have help of AI to develop vaccines or cancer treatments much quicker and faster depending on biosimilar molecules. If machine can interpret an image, it can also interpret your surroundings and then tell you, or people who are visually impaired, as to what could be the obstacles and help them navigate the field much better with with verbal prompt, with audible prompts. There are also few sort of papers that are coming out with case reports when they have used nerve stimulating machines to convey brain's intended activity to the muscles and trying to help people with paraplegia walk. And also be mindful that the applications of AI are not only in healthcare, there is vast amount of applications that are going into other fields as well, including, say, transportation. And imagine having AI helping you drive cars, which would be making them a little more safe because there would be additional technology helping us with the maneuvering, and the chances of having high speed accidents would be less, and that would also have implications about the type of trauma that we would be getting in our emergency departments. And lastly, about tailored treatments, I'll focus on that one because that's again something which is exciting. Let's come to those wearable ones. This is a paper from 2019 from Deloitte Consulting. It's a consulting firm, not but they they imagine this scenario which is present at the moment in fragments but not in totality. It should be, because we just need to stitch those things together. They imagine this scenario that people are wearing smartwatch, and then some of the smartwatches are pinging the person that they have got some rhythm problem, and the machine is asking them whether they should be making an appointment for them with the doctor. The person would say yes or no, whatever, and then the appointment would be scheduled. And not only the appointment is scheduled, the machine or the wristwatch is also sending the data to the healthcare provider. Patient goes to the clinic, they check in with biometric and not even see somebody. They go to the doctor, doctor reviews the person, he reviews the data coming from the smartwatch or the other device, and then he dictates notes to the machine, which again translates into the data into patient's health records. And then the doctor would also send treatment to pharmacy, and then the treatment is initiated, the person is still undergoing monitoring, and the whole circle repeats. You are making things out in community which are in science fiction movies, but that's again possible because pretty much all of these are available in bits and pieces in different places. All that we need to do is to put them together and have a smooth run. You guys are aware of having microbiology cultures and sensitivity tests for, say, urine culture or wound swabs. That helps us pick up the appropriate antibiotics so that we can target the particular bacteria that is causing the problem. Imagine the same thing for tumor cells. We find somebody has got cancer, we take a biopsy, those cells are grown in laboratory, and then we find or try the currently available anti-tumor medications, or even laboratory grown medications on those tumors. We would come up with those that are working fine, and those that are not working fine, we'll choose the ones that are working fine and use them for treating that person. Because even the ones which are not working fine would have exposed us to side effects, we can do away with that added risk of having side effects and not having any good effects from the medications. This is quite exciting because genomics and cancer treatments are one of the really fastly developing fields in artificial intelligence field. Now, nothing comes purely black or white. There are always shades of gray. What are the challenges that we are facing with artificial intelligence? One thing is about accountability and responsibility. If you were to say this is a melanoma based on machine learning telling you this is melanoma, and it were to turn out to be non-melanoma, whose responsibility is to to have it misdiagnosed? Is it you or the machine? Naturally, you cannot put it on machine because at the moment it's your responsibility. So you have to have that oversight, and probably you're supposed to be a little smarter than the machine to take the blame for that. That's the thing which we have to be concerned about. We should be aware of that. We need to be, again, at the moment, not say that this is so because the machine is telling you that. We are not there yet. The other big concern is about those neural network models which are relying upon hidden layers. So that hidden layers which are in the middle part of it between the blue and the green dots, they are doing what they are doing. They are making those decisions which come up as output, but we do not know why do they say so, because it's not something that we are programming with them with. We are not telling them any algorithms. They are developing those algorithms on their own. So when the machine says this is a cancer, we only have to take it either yes or no. We cannot ask machine why is it a cancer, why is it not something else. If it says it's diabetic retinopathy with Alzheimer's with hypertension, we cannot see those things that machine is seeing, but we do not know what it is seeing actually. So that's the black box dilemma, which is again one of the challenges. And it's a catch 22. You cannot ask machine for output because it just can't do that. And you cannot put in more data into it because then it doesn't remain neural network. Another thing which is quite important and say interesting is that if you were to show the machine millions of images and then have it categorize those in 100, say, sets of that type of outputs, be it, say, squamous cell cancer, basal cell cancer, melanoma, and whatnot. It knows those 100 categories only. It would, whatever you show it, it will fit into one of those. It would not have the ability to say, I do not know. It is not there yet. Hopefully, it would be there in future. But this is the dilemma of binary output. You could either get an answer is this is this or this is this, but it wouldn't say I do not know. That I do not know is not there yet. And like I was saying, there could be biases related to the training data. If you have trained a machine for melanoma on Caucasian skin, whether it would work the same on Oriental and Occidental, it's a bit sort of difficult to know. And it wouldn't be considered normal. Coming back to Chat GPT versus doctor. This is an image which Chat GPT generated for me today only when I asked it, please generate image showing AI helping in healthcare. Looks quite futuristic, as if it's not a operating theater, but probably coming from NASA's headquarters. My bit of take on this is that we should be circumspect, but we cannot ignore it. It is going to be more like a combination of us and machines together rather than either us or them. When we say that the chat GPT could pass exams for MLE or pass exams for fellowship, it just means that they were working on very specific, very much collated and very refined sets of data. You have to be only half smart to find that data to be ultimately diagnose something, because it's very precise. If you can miss it, maybe we are not up to it. So machines doing the same job and just scraping through the exams is not something that makes them any more intelligent than you and me. They are here to help, but they are not the ones that can take you over. This is my gut feeling at the moment. Maybe the situation would be different in 50 or 100 years. I don't know. Now, again, future is not something that's out there waiting for us to happen. It's something that you and I create. So if future would be what you and I would create. And again, hoping that nothing would change is again not the right way, because nothing stays constant. The only constant in life is change. And like French author Hugo said a century ago, it is easy to resist invasion of an army, but it is not possible to resist invasion of an idea. I think idea of AI in healthcare is here, and it just can't be repudiated. It can't be just overlooked. And also bear in mind that Nelson Mandela said it always seems impossible until it's done. So we are in that place where it is still not done, and we wonder whether it's possible or not. But I am pretty sure it would be in a couple of months to couple of years to couple of decades. Thank you.